Hello, my dear friends. This is Dr. Charles from PatientCareLinks, where we share practical health lessons drawn from real cases we see every day. Behind many cases of occasional chest discomfort, tightness, burning sensations, pressure across the chest, unexplained breathlessness, or discomfort that comes and goes, there is sometimes a much deeper process quietly unfolding within the body. A process that affects the heart, the blood vessels, the lungs, the digestive system, and the body's ability to deliver oxygen to every organ. Today, I want us to explore a symptom that many people ignore until it becomes an emergency: occasional chest discomfort, the mild pressure, the brief tightness, the burning sensation, the heaviness, the discomfort that lasts for a few minutes and then disappears, the feeling that something doesn't seem right. At first, many people dismiss these changes. It's probably just gas. I must have slept in a bad position. It's just stress. It will go away. And for a while, everything appears manageable. People continue working, continue exercising, continue driving, continue believing that the discomfort is nothing serious. Because chest discomfort often begins gradually, quietly, intermittently, almost unnoticed. But underneath, the body may already be signaling that an important organ is under stress. Because chest discomfort is not a disease, it is a symptom. And sometimes it is the body's earliest warning sign that something more serious may be developing. And that is where the real story begins. One of the most important lessons in preventive healthcare is that serious medical conditions do not always begin with severe pain. Chest discomfort frequently follows this pattern. The earliest symptoms may seem harmless: a brief tightness after climbing stairs, a burning sensation after a meal, pressure while walking uphill, a dull ache that disappears after resting, occasional discomfort during emotional stress. Nothing dramatic, nothing that immediately feels life-threatening. So life continues normally. People continue working, continue blaming indigestion, continue blaming muscle strain, continue ignoring the warning signs. But underneath, the cause may be very different. For some people, the discomfort comes from the heart. For others, it may come from the lungs, the digestive system, the muscles and ribs, or even anxiety. Then the pattern begins to evolve. The discomfort lasts longer. It occurs more frequently. It happens with less activity. It may spread to the neck, the jaw, the shoulders, or the left arm. Shortness of breath develops, sweating appears, dizziness follows. The body is not sending random signals, it is asking for attention. The chest contains several important organs. The heart pumps blood throughout the body. The lungs bring oxygen into the bloodstream. The esophagus carries food to the stomach. The muscles and ribs protect these vital organs. Because so many structures are located in the chest, discomfort can arise from many different causes. Sometimes the heart muscle does not receive enough oxygen-rich blood because the coronary arteries have narrowed. This may cause angina, especially during physical activity or emotional stress. Sometimes a blood clot suddenly blocks one of these arteries. This causes a heart attack. At other times, stomach acid flows back into the esophagus, causing heartburn that may feel very similar to heart pain. Inflammation of the chest muscles, lung infections, blood clots in the lungs, or anxiety can also produce chest discomfort. Now observe the biological domino effect. Blood flow decreases. The heart struggles to receive enough oxygen. Chest discomfort develops. Activity becomes difficult. Breathlessness follows. Without treatment, heart muscle damage may occur. Or, if the cause is another condition, that illness may also continue to worsen. What first appeared to be just a little discomfort may actually be an early warning sign of a much larger problem. From the medical perspective, chest discomfort should never be ignored. Doctors aim to identify its cause as quickly as possible. Depending on symptoms, they may recommend a physical examination, an ECG, blood tests to check for heart damage, a chest x-ray, an echocardiogram, a stress test, CT imaging, or other specialized investigations when appropriate. Treatment depends entirely on the underlying cause. That is why self-diagnosis can be dangerous. Now bring in the nursing perspective. Nurses often identify important warning signs before serious complications develop. Chest discomfort during activity. pain spreading to the jaw or arm, shortness of breath, cold sweats, nausea, dizziness, fainting. Patients should seek urgent medical attention if these symptoms occur. Nurses also encourage healthy lifestyle habits such as controlling blood pressure, managing diabetes, stopping smoking, maintaining a healthy weight, and attending regular medical checkups, because prevention remains one of the strongest forms of treatment. Now, bring in the pharmacist's perspective. Many people buy medicines for indigestion whenever they experience chest discomfort. Sometimes this provides relief. Sometimes it delays the diagnosis of a heart attack. Pharmacists encourage patients not to assume every chest discomfort is caused by acidity. Medicines should only be used appropriately and after proper assessment when symptoms are unexplained or recurring. Patients should also inform healthcare providers about all medicines they are using. Now bring in the dietitian's perspective. Good nutrition supports heart health throughout life. A balanced diet rich in vegetables, fruits, whole grains, and beans. Fish, lean proteins, healthy fats, reducing excess salt, limiting foods high in saturated fat and added sugars, maintaining a healthy body weight, regular physical activity, adequate sleep. These habits help reduce the risk of many conditions. Now step back and connect the full picture. Chest discomfort develops. The body sends an early warning. The heart, the lungs, the digestive system, the muscles, the circulation, overall health. The symptoms become more frequent. Daily activities become more difficult. Overall health begins to change. And gradually, what first appeared to be just gas becomes a symptom that deserves careful medical evaluation. This is why chest discomfort should never be dismissed without understanding its cause, because the symptom is only one part of the story. The larger story involves discovering what the body is trying to tell us. Many causes of chest discomfort can be treated successfully when recognized early. Persistent chest discomfort deserves attention. Chest pain during exercise deserves attention. Pain associated with breathlessness deserves attention. Pain that spreads to the jaw, shoulder, back, or arm deserves immediate medical attention. The encouraging reality is this: when the underlying cause is identified early, appropriate treatment and lifestyle changes can save lives. Observe the pattern. Protect your heart. Listen to your body. Do not ignore recurring chest discomfort, because sometimes what people call just gas is actually the body revealing a much larger story unfolding underneath. Thank you.